No, you're not. You're overseas.
Hi guys, I just want to welcome you to this presentation within the Charles Perkins Centre's Integrated Nutrition Seminar Series. My name's Tim Gill. I'm sort of late at, well, not late at the CPC, as you can see, I'm still alive, but previously within the CPC, and my co-chair today is Dr. Holly Harris. I was going to say Holly Hunter. Who will be introducing our speaker later on. But before we start, I just want to acknowledge the traditional owners on the lands in which we meet today, the Gadigal peoples of the Eora Nation, and pay respect to their elders, past, present and emerging. And just to reflect on the fact that the issues which we're addressing today are actually very relevant to the traditions and law of Indigenous peoples. And so we have a lot to learn from their reflections on that. And also to acknowledge that the building in which we're meeting today, the Charles Perkins Centre, obviously reflects one of the most prominent Indigenous graduates of the University of Sydney, Charles Perkins. So I'll hand over to Holly, who's going to introduce our speaker, and we'll come back and ask questions later on.
Thanks, Tim. So Margaret is a Professor of Nutrition and Dietetics for the Faculty of Medicine and Health in the Sydney Nursing School, and has been a stalwart of nutrition research at the University of Sydney since the 1990s. So that's very fitting for this topic, focusing on millennials and Gen Zs. She joined the Charles Perkins Centre at the beginning and was the first in the tranche of people to move back in 2014. She offers the centre skills in digital dietary assessment, although this is not the topic for today, nutritional epidemiology and nutrition promotion, having published more than 300 papers. She is a fellow of the Nutrition Society of Australia and Dietitians Australia, and is current chair of the Academy of Science, the National Committee for Nutrition. So please welcome Margaret.
Thank you very much, Holly, for that introduction. Moving forward, yeah. It is an honour to present to you today in the Charles Perkins Centre, and I acknowledge the Gadigal people of the Eora Nation, and I would like to pay my respects to their elders, past, present and emerging. I would also like to pay my respects to any Aboriginal or Torres Strait Island people who are present in the audience today. The work I'll present was funded by HCF, ARC Cancer Council and bridging funds from the DVCR, and other funds are listed at the bottom. I need to express my positionality from the start. I acknowledge I'm a white Anglo-Australian middle-class older woman, and I'm a dietitian nutritionist. My research applies the lens from my experiences in basic nutrition science, nutrition epidemiology, health promotion and evaluation, and clinical nutrition. Today I'm going to be telling you why I studied the younger generations, what they eat, where they eat it, why do they eat it, how do they change, and what are our new challenges. So what was the journey to study Gen Y and Z? And this started about 20 years ago. I do want to say to you that I believe that studying nutrition at every stage of the life cycle is important, not placing more importance on any than another, except perhaps for the first 2,000 days. So each has its challenge and each is worthy of study. I happen to be studying the younger generations. So I'd like to introduce the concept of generation. All of us are young at one time, and being a certain age is associated with certain behaviours. For example, adolescents are risk takers, But remember that in the 1960s, the risks taken were different to the risks today. Also, remember that all of us, whatever our age and stage of the life cycle, are experiencing the current environment. We talk about the food environment. We're all experiencing the same environment, and it will affect all of us. But in addition to that, there's an effect of generation or the cohort you were born into, because you experience the events at the same age, and that's going to affect your behaviour across your life cycle. I see we have many millennials today who are Gen Y, born 1980 until 1996, and now 29 to 45, you're getting middle-aged. Gen Z is born 1997 until 2012, and are adolescents and young adults. I define young adult as 18 to 30. In the United States, it's defined as 18 to 35, and that's in keeping with ARNET's 3 stages of development towards adulthood. And 18 to 24 is a very important group, our students, emerging adults. So I'm going to start with an old story, and what I want you to note here is that this is about birth cohort in 5-year intervals. And if you look, you'll see starting at the bottom, born 66 to 70 and going up. This is at age 22. What do you notice straight away? That the mean BMI, according to when you're born, is going up, as is the prevalence of obesity. And you'll notice the same for women. Now, I haven't done such an elaborate analysis again, but I've taken the National Health Surveys for you. So down the bottom, we have the 2014 National Health Survey. You can see again in that 10-year gap, the millennials are coming to adulthood, 18 to 24, with a higher BMI for the men and for the women, and we see increases in prevalence of obesity, but using these figures not consistently. What I would say to you is that we probably need to do the analysis so that we make them comparable and standardise them. But you get the general gist that over time there has been an increase in the BMI at which young people are reaching adulthood. Now, the last thing I want to do is to stigmatise any generation or any person. And I certainly don't want to be a person responsible for causing alarm and eating disorders. But I do think that it's important to note this point. Here, I'm showing an analysis by Adams of an American cohort of 110,000. And what you'll note if you go to the bottom is age at which you reach BMI of 25 and above for the first time. So you'll see at age 18 that the hazard ratio for dying is 1.76 for males and double 2.08 for females. If you reach it at 35, you have a higher risk than if you reach it at 50. So for these reasons, I think it is important to think about the consequences of what's been happening to our younger generations. This is another way of looking at it. Here is a depiction of a cohort from Glasgow University. They managed to find students many years later. And here they have the BMI at age 20 along the lower axis. You can see the line, the hazard ratio for all-cause, cardiovascular, and smoking unrelated cancer. And what you will see is that once the BMI reaches 25 at age 20, there's an increase in the risk of mortality. And indeed, David Ludwig said, modern medical care may prevent premature death among adults who develop obesity at 45, diabetes at 55, and heart disease at 65, but not if the sequence of events is set up in childhood or those early adult years. So for these reasons, I think it is important that we look at Gen Y and Gen Z, and we look at health promotion. As a dietitian nutritionist, I'm naturally going to make a contribution in the area of nutrition promotion, but of course, keeping in mind my colleagues in physical activity and sleep being equally important. When we went to the literature 15 years ago, we did find that the younger generation was the forgotten generation in health promotion. We could only find 9 studies. This picture's Lana, who was a PhD student at the time. The studies were 7 in the US. They were small numbers, very short duration. The promising light was that they did seem to be showing some positive effects. Now, what is it that the millennials and Gen Z are eating? The millennials are known in many circles as the smashed avocado lattes. You may have heard that expression. Also, they're referred to as fruit, plant-based eating, and clean, heaven forbid, I do not like that term, eating. Whereas the Zs, well, they're the generation of the frozen microwavable meal. And the term snackification was actually invented then to refer to their dietary pattern across the day. Continuous snacks, crazy. But I really don't like to get my nutrition information from marketing and popular press. I do prefer to go to the national source of data. So what is it that the younger generations are eating? Well, if you look around the world, there's actually some very characteristic dietary behaviours. They're high consumers of sugar-sweetened beverages, low consumers of vegetables, and high intake of food prepared away from home. So in America, in Australia, in Canada, in the UK, this is what you'll see. Is it still true in 2023? I draw your attention to where the arrow is. We have the 18 to 29-year-old consumption. So dietary surveys do not occur very frequently. Those who want to work with the data know. We had 1 in 83, 95, 2011, 12, and 1 in 23. The other perhaps annoying thing about it is once we do one, it takes at least 2 years for the ABS to give us any results. And then it takes us about another year to get access to the data to start to analyse it ourselves. So analyses today will give you 11, 12, but I'm trying to give you what information the ABS has for 2023. Anyway, you see here it is that the 18 to 29 are the highest consumers among adults of soft drinks. Similarly, if we look across to vegetables, the prevalence of people reporting any vegetable intake is lowest for the 18 to 29-year-olds. Those below are children, so they have different requirements for vegetable intake. So that's foods, but when we talk about diet, we really want to look at a dietary pattern. So what do people eat throughout the day, over the weeks, over the months, over the years? This is what's going to determine their health outcomes. So there's different ways of characterising dietary patterns, and Amanda Gresh, for her PhD, looked at many of these patterns for us, and I'm very grateful to her for her work. So I'm showing you the pattern of energy density. Energy density refers to the kilojoules per gram of diet, and a low energy density is much preferred to a high energy density. So if you look, the 18 to the 29s are the first group here. This is women. We have 2 dietary surveys here. You can see that the energy density of the diets of the younger women is the highest. Let's look at the men. Again, the energy density of the diets of the younger men is highest. We did get a drop in energy density from 95 to 2011. I'm not going into all the other age groups, but that actually is quite interesting. It shows like diffusion of innovation of high energy density diets across the age groups with time. Another way that we look at diets is to see how a diet compares with the recommended dietary intake guidelines of a country. So back in 2003, from an MPhil in public health, I created a HEPA, Healthy Eating Index for Australians, which measured somebody's compliance with the recommendations from the Australian dietary guidelines. The Americans have done that. We have not done that. What you need is to get a score out of 100. 100 would be the best quality diet. So we're looking for 100. Look at our 18 to 24-year-olds, only 41.6. So they have, in terms of dietary guidelines, the poorest quality diets, and we do see the trend of improvement across the deciles. But I say note, the score's at 100. No one's getting a pass on our national. Now, there's a very good reason why people aren't doing well for energy density or for the HEFA, and that just requires a look at their intake of the 5 food groups. So we have 2 types of food currently in Australia, the 5 food groups, which are listed along the bottom, which are recommended to eat, and then we have the discretionary foods, which are like ultra-processed foods, high in saturated fat, sugar and sodium, and we're supposed to eat those in very small amounts. Here you can see that the 19 to 24 in this analysis, not even having half the vegetables, half the fruit, not meeting other basic 5 food groups. So what gives you a low energy density diet are vegetables and fruit. Foods which are high in water and fibre and low in energy will dilute out the other ingredients in a diet, like high fat, high sugar, etc. So if we look around the world, there's another way of analysing diets, which was a posteriori approaches with clustering or PCA. And even in countries such as Japan and Brazil, when you look at the diets of the young adults and the clusters they form, they'll always have an unhealthy dietary cluster. And we see this Americanization of diets. So we see the sugar-sweetened beverages, the confectionery, the cakes, the fries, the pizza, etc. So this pattern is quite common to young adults around the world. The next question is, we know what they're eating, where do they eat, and how is that influencing what they eat? So we were a bit tired of the 11-12 data. We decided to collect our own, and I thank Linda Willard-Cole, who was the PhD student, for helping us to do that. So we collected data on 1,000 young adults across New South Wales. It was the reason for that, and I'm going to show you a few slides from that. Note, 57% were female, 54% 18 to 24, the rest 25 to 30. 40% were of low SES, 2/3 were living in a metropolitan area, and the mean BMI was the cut point of overweight at 25. So we designed an app which allowed us to collect the data. They all did 3 days of recording. The app had things like location, and you could click on McDonald's and would have the full list of McDonald's meals, so you could pick what you wanted to. So we had made it easy with this designer app to record where and what you were eating over the 3 days. We did have a sub-study with people wearing wearable cameras. You can see an output of that. That allows us to see where, who they were with, and what they were eating. We did validate the app intakes using a 24-hour recall, ASA 24, and we did validate the iPad physical activity. This is a leash. She was putting acceleron to some people to do that. What did we find? All those thousands of meal occasions, 32% prepared outside home, 37% come from a chain, and 61% from an independent outlet, not a chain. Why might that be important? Because with respect to policy, it's only the chains with 20 or more stores that have to put that energy labelling on their slides. And here we were finding that, well, that didn't make the majority of meal occasions where people purchase food outside the home, and that was escaping the policy. Also, we found, if we look at energy and the nutrients of concerns, that fat, sugars and sodium, that while it was 32% of occasions, you can see it's contributing a greater percentage to those nutrients. And here you can see the independents are giving more to those than what are the fast food chains. Also, this is Virginia in the audience, and she meticulously coded all of those images that were collected from the cameras. And she did kind of a basic overview of the coding. And she looked at 5 food groups and discretionary categories and found if you ate at home, prepared at home, much more likely to be healthy than if you purchase the food outside the home, more likely to be unhealthy. Not surprising. Now, this is not about location, but I did want to show you, we did a sub-analysis of snacking behaviours of the young adults in the study, which I think is quite promising, actually. So if we look at frequency of snacking, you can see that fruit was actually the #1 snack. And that was followed by chocolate, cakes, desserts, sweet biscuits, ice cream, and frozen yogurt. If we look at the contribution to energy, of course, that does change. The cakes and desserts are the ones giving more energy than chocolate and fruit. And then we've got potato crisps and ice cream. But it does mean that perhaps encouraging fruit and portion control of cakes and desserts may be able to help us when it comes to snacks in the snackification Gen Z. So why do people eat that way? Well, I think we all know probably why they're eating the way they do. But what are we going to do about it? Why do people eat what they eat? So for this, I'm giving you an example of 2 different time points when we looked at food choice determinants. So there's a standard questionnaire by Steptoe that gives you all of these reasons and you select which of those that determines what you eat. We've adopted a newer version of that, a shorter one, with a study we've got in field at the moment. So these are only preliminary results. It's not published. Please don't take it as you've taken a photo, but do not take it as finished. It's in the field. But as always, why do we eat what we do? Because it tastes good. And there's actually a really good biological reason why taste is important for us to decide what we eat. Value for money and cheap and convenient. And you can see that the same answers are given in both surveys. So you can think about it yourself in our food environment. What tastes good, what's cheap and what's convenient, what are people going to eat? Now, the young adults themselves, though, are not without some advocacy and thoughts about the food environment. And I conducted a series of focus groups where they told us what they thought should be done to improve the food environment. And they were really into the idea of labelling. So many of them knew about kilojoule labels and told us they wanted to extend those. Some of them were quite familiar with traffic lights, and they suggested that food, when they went to purchase it outside the home, should carry these sorts of labels. They knew the spoons of sugar as well, that had appeared with the sugar sweetened beverages and the Cancer Council campaign. They liked that. Some of them wanted to be more inventive, for example, listed as how many burpees you need to do to use a Mars bar up. But they also knew about nutrition misinformation. These were university students. And they told us they would only trust credible organisations. When we expanded on that, they thought the Heart Foundation was very trustworthy in terms of their advice. They led us to understand that the phone controls everything. The smartphone is the centre of all your nutrition advice, selecting meals, what are you going to have? So this is back in 2019. The digital food environment, I'm so glad many of you are starting to study that because it is so important to these younger age groups. They go on social media, their peers recommend it, they see the food, they see what restaurants recommend it, they order food. So it's a very, very central, the digital food environment. for the younger generations. They actually gave us the advice that we should start to use that to try and nudge people in the right direction. And so they found value in us having positive imagery and negative imagery to move people towards or away from unhealthy diets. And I know people with CPC are doing that now. We had done other focus groups with slightly older millennials, and they told us about the social environment and the importance of the social environment on consuming food prepared outside home. They gave us the 3 Ps. Their partner influenced it, their peers influenced it, and as well the parents. I really like this first one, who explained you've got a great food environment at home. Your parents have all the healthy food on the shelves in the fridge, but I left home and I've got nothing, so I just have to go and get convenient food. So that's something to keep in mind when you're planning programs. Other ways for improving the food environment, they all want discounts for healthy food, and healthy food was definitely viewed as more expensive. So in the earlier survey, the top 3 suggestions from our students here to change our local environment was healthier food for lower cost, cheaper food, more discounts. When we asked the question, do you agree or disagree with prices should be lower support healthier foods? This year, they strongly agreed, as you can see. So that's what they want. If you want us to eat healthy, supply the food and give it to us at a good price. I was interested to see, because Gen Z is supposed to really be into sustainability. So these are preliminary. I don't know what the final findings would be, but I was quite interested. So they really like free drinking water. They want free drinking water. They don't want plastic bottles everywhere. They liked the idea of better packaging, minimal packaging. Only 50% of them thought that we should minimise processed food. So they weren't strongly compelled to minimise processed food. And similarly, they were not compelled to source local food either. So perhaps some of the things we might expect with sustainability were not spoken of. So that's what they think, that's what they're eating, that's where they're eating it. Can we change them? And I'm going to show you some older research on that. So way back, Amelia Cook looked at these typical behaviours that we saw among the millennials, and we asked them if they intended to change them. So 87% of them didn't eat adequate fruit and vegetables. 57% said they would like to change, which means that 2 in 3 said they would like to try more fruit and vegetables. When it came to takeaway food, a little over half said they would like to try and change that behaviour, but they like their sugar-sweetened beverages. Less than half seem to be willing to give those up and to change that behaviour. But if it involves physical activity, everyone's going to do that. So physical activity people have it far easier than the nutrition people. So we did decide to do a program back then, and I wanted to show Lana and Kate who helped on that. And we got into the whole idea of digital very early. So we ran an M Health program, and we threw everything at it. You name it. We had text messages, coaching calls, smartphone apps we developed. We had everything. And the program went for 12 weeks. And after the 12-week program, we followed them again at 36 weeks. And while it was a program for healthier eating and prevention of weight gain, we did find that those who were on the program had a lower weight at the end than those who were not. And they had increased their fruit, vegetables, SSB, and takeaway food. So the millennials and Generation Z can change, and we should be continuing our efforts to help them change. We thought, this is another student, Monica, she did vegetables. Now, as you can see here, vegetable intake 151 is only half or less than half, it's only 2 serves. So they don't eat enough vegetables. Her light bulb moment was when she analysed all of the national survey. And what she found is that if you only ate vegetables at dinner, you were never going to reach your goal. Now, it seems a simple message, but if you start early in the day, you're going to reach it. So she made a theory-informed, she did apps, so she made theory-informed apps. She used the COM-B model, and here you can see all the things she did to address those different theoretical components. But she did do a 4-week feasibility trial. But if you look at the quote on the right-hand side, that really tells the whole story of her apps. She could run the trial, no problems, but they reported that the apps helped them to increase their vegetable intake at the time, but once they stopped the tracking, they weren't accountable for their intake, so they were not doing as well. And we did see the longer you engage with the app, the greater the vegetable intake. But if you stop engaging with the app, then you are going to slip back in most cases. And this is perhaps the story of apps and why apps need something else, because people, we found, need accountability when you're doing digital health. Digital health on its own with this group was not having the effect. They can get away with it if no one knows what they're doing. Then we decided to get into the social media. So this was Annika who did Facebook. She did a Facebook she did have an app tracker, but she also had 3 arms, Facebook with text and with control. And the one with the text increased the engagement with the Facebook and led to a change in knowledge. And I believe the reason for that is it was 2-way texting. They had to answer every so often, and that introduced accountability in terms of what the people did during this social media intervention. Now, other people like Virginia went on to look at Instagram, Gen Z relating to that. That's another story. I'll leave that to other people. Then there was a big change for everyone with COVID-19, and that did have a change on my research program. It kind of stopped that whole promotion and made me think what would be the most important thing I could do for our community during those 2 years of lockdown. And among them was the thought that food security was really, really important. As you know, for the first time, we had all these empty shelves and vulnerability in the Australian food system. Many people, for the very first time, families became food insecure. What really stood out was that the international students were very, very vulnerable. Our international students couldn't travel outside Australia. They were locked down here. They could not work. There were no jobs for them in the hospitality or in the sort of retail sector, food and beverage sector. So they were very vulnerable. And Serena actually put all that data together for us as quickly as possible. For those of you who do not know what food security is, the definition of food security is a situation that exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. So it's quite a tall order to meet all of those criteria. It's not just about money, it's about other things. And we talk about the 6 pillars of food security, and I'll be showing those to you in a moment. Now, we looked at, is there an association among university students between food insecurity and dietary outcomes? And this is Yuming Chai, who was doing this work for her PhD and was in lockdown and had to remain in Australia during her PhD. I want you to look at the shapes below the red line. The shapes below the red line show that there's a negative association of food insecurity with dietary outcome. And not surprisingly, fruit and vegetables, and in this case grains, are most affected by food insecurity. They're foods that they were unable to contain sufficient amounts. An overall assessment of diet does show that if you're food insecure, you're less likely to be able to meet your nutritional requirements. This is an example of a smaller study conducted here on the campus at the beginning of 2022, when the subjects just came out of the lockdown. And here we used HEFA that I showed you before. How well can they adhere to the dietary guidelines? And you can see that the food secure group had a 10-point difference from the food insecure in achieving their HEFA. So it's only small, but it indicates that food insecurity makes it difficult to meet your diet quality. This is the larger survey that was taken around that time. And look at the top line. Those percentages on the top line are for all students, and then domestic versus international. And they're the food secure. They have enough access to food. Those on the bottom are food insecure. So at that time, we found 1 in 4 domestic students had food insecurity, and 1 in 3 international students had food insecurity. Just to give you a little more insight into semi-structured interviews, that's Nima and Helen again, that were conducted with 19 to 27-year-olds, and they were largely Chinese and Indian students. Now, what I've done here is take her results and I've mapped them onto the pillars of food security. So we'll go around each of the 6 pillars of food security. This was not what she did, this is what I did. And I found with availability, the comments that their preferred food was not always available in Australia. That's one of the pillars. Financial access was a problem. They found the foods, especially fruit and vegetables, very expensive in Australia. The physical was a problem. We had, for example, I remember one Indian participant who told us it cost them money and they had to go all the way out to far West Sydney to obtain the ingredients they need to be able to make the food they wanted to have. When it came to utilisation, those living on campus in some of the provided accommodation told us the kitchen facilities left much to be desired, as did food storage. So they found that pillar, utilisation, not to be adequate. Agency, they said they need a voice on campus for what they need. Sustainability, they did not talk about, and the stability, they did mention the seasonality of obtaining some foods they wanted. So that was 2022, and people said to us that, well, your results are probably just due to COVID and they will all go away. But as you can see, the Senate Select Committee report that came out at the end of 2024 rated food and groceries as the #1 pressure in Australia for cost of living. So I don't think that it's all gone away over COVID, and naturally this is going to impact the most vulnerable in our society. So we're in the field and we're looking at a recruitment to measure, among all the other things we're doing, food security. This time we're using the 6-item survey, which is largely about financial access to food, to be honest. Now, look at the top line this time. These are the food secure percentages. And look at the bottom, the total food insecure. And I only just looked at this the other day because we haven't reached our numbers, but I've gone from 1 in 4 to 1 in 2 domestic reporting food insecurity, and from 1 in 3 to 2 in 3 internationals reporting food insecurity. So these are students on the campus of the University of Sydney I do not know if our survey is in particular attracting these people who are having a problem. That's why we need to get more data, and obviously we'll act. But I think that's very disturbing on first look. I don't have the explanations. When I looked at their food bank usage, they reported about 40% of those who were food insecure were using a food bank, and most of them were using the university food hub. Some went external and some used both, but 60% had not gone to a food bank. I think what's interesting for our consideration and for letting USU and Student Life know moving forward are some of their comments. So, for example, they like the idea of a food or voucher scheme for low-income earners. I believe the university, like the University of Melbourne, would be considering a restaurant-type setup. They also said there should be a greater focus on cheap and nutritious meals. I found it insightful. They told me the food truck, which they said junk processed food, is charging $20. So they don't want the food trucks. They want something healthier as their options. They also, this was interesting, he explained, yes, the free breakfasts are very, very good, but I have to work night shift to survive. So is there any chance of a dinner and not just breakfast? And also the idea that maybe you could get a cheap coffee and a free snack, maybe that fruit, to give to people to make it convenient and affordable. Even if you're food secure or insecure, everyone's complaining about the cost of coffee on campus, that it's too high for students. So I might leave it there and say what's next. Obviously, we'll finish the survey and then we'll act locally. If you ask me what's the best bet that we can do for helping Gen Y and Gen Z, I would say change the food environment, because when you change a food environment, every single person in the society is going to benefit, rather than only concentrating on individual change. But we still should ensure that they all have food and nutrition literacy and that it's equitable. The most vulnerable in our society are usually those who don't have a say in any of these surveys and are left out. And if you're going to change something, you have to have supportive policy. And I guess I'd end by saying food security is a basic human right. And if we don't address it in our own university, where are we going to address it and have credibility? So I would like to finish by thanking everyone in Nutrition and Dietetics, Public Health Information Technology and the Charles Perkins Centre. And I give a special mention to Adrian Bowman, Stephen Simpson, Kevin Patrick and Eric Kettler, who actually have challenged me how I think and supported me. Thank you.
Thank you very much, Margaret, and thank you for challenging and supporting us throughout this great presentation. I'm going to pass over to Tim, who will then just hand around the mic if there's any questions.
You got any questions, Anne-Marie?
Thanks so much, Margaret.
Oh,
Thanks so much, Margaret. It's always just brilliant to hear about that, like your work, but also the way that you were able to present that temporal perspective on what you've learned, and then also the disruptions that you also were noticing. I've been really impressed at the university's $5 meal initiative, and I was wondering what you think about that, given that you know a lot more about the dynamics that sort of surround this type of initiative.
Yeah, I was really pleased with that too, Anne-Marie. I thought that was really good. We did get comments on those and they said that it's a great idea, but the problem is the serving size is too small for men. So I have to have 2 to satisfy myself, and then it ends up costing me more. So that was interesting, and we'll see if anyone else feels like this. Perhaps this was a young exercising individual who needed more food. I do think too is that we should be congratulating the university on their attempts and what they do. And while our colleagues have gone out and said these are nutritionally not great, what I would say, we don't always want to do that. We want to work together. We don't get anywhere if we just keep, what would you call it, criticising efforts. We need to offer our services to ensure that we have the types of things we need. Yeah, thank you.
Thanks, Tim. Thanks very much, Margaret. Really stimulating presentation, and it's great to have the opportunity to learn about your thinking, about the problems you're working on and also solving in many cases. One of the, I suppose, big challenges to pick up on Anne-Marie's question is how to change the food environment. And clearly a sort of micro food environment reform is one way to approach it. I'm just wondering whether, when you look abroad, whether there are models that you're seeing at a national level that we could potentially try to follow.
It depends if we're talking about at the local level and following what they've done others at the local level, or if we're talking about the whole country and what we're going to change. Everyone knows it's very difficult, and there are many people at this university who are working on that problem and trying to change it. I think many of us went to a talk by Phil Baker not so long ago, and we're all trying, and in countries like Australia, UK and US, we're not necessarily winning. We need to go to some of the other countries. I mean, at the moment, it is the South American countries that are really having quite an influence on what's happening with their food supply. And they have changed their labelling, they've changed the way they look at foods. We need to do simple, we have to work at every level, as you say. So if we can, we need to obviously get individuals to ask for change. We need to get communities to ask for change. We need to get governments on board for change as well. But governments are voted by the public. So I think getting public opinion on our side is going to help. And there is quite a movement for healthier food for children, and many examples of interventions in that area. So it's the $1 million question. No one thing is going to do it, and you have to look at every single level and try and get change. And also, we're very cognizant people should have choice. So it's not necessarily our we inflict our beliefs on others, but people can only make choice if there's something to choose from and they're informed and educated. And nutrition literacy for all, which includes cooking and shopping that they see, is really important to be achieved. We are starting to achieve it in schools, but a whole lot of people can start. We need to do something to help them at the community level.
Any other questions?
Tim, there's some online.
All right, sorry, I'll come to those. Thanks, Lois.
Thanks, Margaret. So your energy density with age over time data, you're pretty convincingly showing most age classes energy density of the diet has risen. But within a cohort, within a time period with age, energy density tends to fall. So younger people generally have higher energy density diets than.
Well, they do, and they younger people have higher, they're exercising, have higher nutritional needs. But what we do, obviously your energy requirements in the younger phase of your life are higher than in the older phases of your life. But to explain with energy density, as you saw there, it was lower as we went across the age groups. But the interesting thing that's happened is that over time, in the initial surveys, it was the young with a high, but over time, the older groups have gone up in their energy density. So they're obviously in the food environment and starting to eat all that other sort of stuff and change their diet from what their traditional diet had been in their younger life.
Yeah, so I mean, I'm just sort of generally interested in this idea that the energy density of your diet changes as you age. And so you must be making different food choices as you get older.
Yes, we probably, as you saw, we don't have the sugar sweetened beverages so much as we get older. We are looking at vegetables perhaps more than the younger people. We're not eating all our food that's prepared outside the home and all of the energy dense food that they pick up at restaurants, cafes, fast food, etc. Not as much as young people. Yeah. One of the difficulties, though, it'd be great to look at it if we could get a better data set. Yeah, because we're restricted with those food surveys. We've only got 3. We haven't even got the results of the last one.
So Tim, I think Louise had a question.
Hi Tim, yes, and Margaret, thank you. I actually put this in the chat if any of you can see it. So thank you so much, Margaret. You refer, as I do, to healthy and unhealthy foods, and I'm unapologetic about it, but others are incredibly anxious that we do not refer to unhealthy foods in health promotion, in talking to patient populations and so on. What are your thoughts on that? And why do you use the term healthy and unhealthy?
Well, I did in that example, but I always put that in inverted commas, and that was using the broadest level of categorization. I think what I tried to say is that what's really important is amount and frequency over an extended period of time, not in one setting. I don't know what we're going to be saying moving forward, Louise. Maybe, there would be a different name, but at the moment we talk about the 5 food groups and discretionary foods, and that's what we call them, and probably should be calling them. But in this audience, I'm comfortable to give the growth healthy and unhealthy. But I guess if I'm talking to a group of people in the community, I wouldn't use that term. I would use 5 food groups and discretionary. And everyone will go, what's discretionary?
Yes, I was going to say, I think people have, the general public has an understanding of unhealthy foods, which are generally things like junk, ultra processed foods, sugar sweetened beverages, etc., which is what we're largely talking about. And I keep remembering, and discretionary foods really doesn't communicate to anybody other than those who've worked in the nutrition environment, as far as I can see. I mean, I understand, but the general public doesn't quite get it, or even the term sometimes food. I've had my patients say, sometimes I have it for breakfast, sometimes for recess, sometimes for afternoon tea, and that idea about how often you might have a discretionary food is somewhat lost. Okay, it's very interesting. Thanks.
I can't see any other questions in the chat online. Does anyone else want to jump in online? No, so we have one last one in here. While we're waiting for that, I just asked Margaret, have you heard about the changes to the game monopoly for millennials?
No, that sounds a good one.
When you go around the board and land on a property, you can only rent it, you can never buy it.
I had a question. Is this on? About the food insecurity, and part of that was food availability and access to preferred foods. I'm quite unfamiliar with kind of how these things are categorized, but access to preferred foods is very subjective based on culture, socioeconomic status. Is that the only way that category is defined? Because, for example, access to healthy foods or seems to be more maybe appropriate for food availability?
I think that that's a good point. I think preferred food really covers the cultural aspect, as you've alluded to, and is really important as well to consider. And I think the other concept, which we haven't really quite put it in food security, although it is there, is making sure that they have nutrition security as well as food security. It's kind of encapsulated, but
that was what I was wondering.
Yeah. There are questionnaires now that kind of look at both aspects.
Okay. Yeah, something that I've thought about a lot, not from a research point of view, but I got stuck in a food desert in the United States for an extended period of time, and that was incredibly distressing. And so now I think about all the people that actually live in those environments and they don't actually have access to any nutritional food at all.
That's really interesting because States have started doing all this work on the two concepts. Thank you.
I just want to end by following up on Al's point, the question before. So when you started the presentation, you gave the health outcomes of different generations. Do you think that, or the nutrition-related ones, do you think that reflects the fact that younger generations aren't as health conscious or as concerned or as committed to health as older generations, or is something else driving that?
I think the driving factor probably is the environment they've been exposed to from the time they were born. So it's more the influence maybe of the environment around that group during their formative years that has driven that. And Louise is here as they, as all over the past 20 years, all the advances in childhood education and looking at prevention of unhealthy weight gain, hopefully that effect starts to come through. What do you think, Louise?
All I can say is that we absolutely must address the broader food environment. So the wonderful work from my lovely team over the last 2 decades is that an intensive intervention when children are very young can actually make differences in breastfeeding, complementary foods, activity, etc. by age 2. But if you stop doing it, the intensive intervention, it goes away by age 5. When you put together all the studies in the world that have looked at outcomes at age 2 by having parent-focused intervention, no difference overall in BMI. We published that in the Lancet last September. And basically, if you expect a parent-focused intervention, really important as that is, to actually overcome a broader obesogenic environment, you will fail. And what we've got to really do is address that broader obesogenic environment, healthier food environments and so on. Absolutely must intervene in early childhood, during school, young adulthood, midlife, etc. But if the healthy choices are almost impossible to make for whole lots of reasons, then you will fail to really change interaction, the health of the broader individuals. If we keep focusing on an individual to make change and don't do those broader upstream issues, then we run into problems.
But the real problem is that the foods taste good, they're
cheap, they've got long shelf life. Yes.
So that's the major driver.
Right, before we finish, I'll just add one last dad joke. How do you express the weight of millennials?
Here's the millennial. We're coming for you.
Of course, it's in Instagrams, not kilograms.
That's very good. That's very good American. Excellent.
I'm old enough to be able to suffer dad jokes. So before we go, I'd like you to join me again in thanking our speaker today, because Margaret's spent 2 or 3 generations dealing with the new generations in her research program, and she's presented a great overview today. So would you join me in thanking Margaret?